Today we're talking about something that makes a lot of people uncomfortable, but it's incredibly important. Sexual health. This is one of those topics where people have so many questions but feel too embarrassed to ask their doctor, their friends, or really anyone. So I'm going to address some of the most common questions I hear in my practice, and I want you to know that whatever you're wondering about, you're definitely not alone. Before we dive in, I want to say that sexual health is health. It's a normal, important part of overall well-being, and there's nothing shameful or embarrassing about having questions. As doctors, we've heard everything, and I mean everything. Nothing you ask is going to shock us or make us think less of you. In fact, we want you to ask these questions because sexual health affects your physical health, your mental health, and your relationships. Let's start with one of the most common questions I get, especially from men. Is my size normal? This causes so much anxiety, and it's largely because of unrealistic portrayals in media and adult content. Here's the reality. The average erect penis is between 5 and 6 inches in length. That's the average. There's a wide range of normal, and most people fall somewhere in that range. What you see in adult content is not representative of reality. Those are selected specifically because they're unusual. And here's the important part. Size matters far less than most people think it does. Sexual satisfaction is much more about communication, emotional connection, foreplay, and understanding what your partner enjoys than it is about measurements. If you're concerned about satisfying a partner, focus on being attentive, communicative, and willing to learn what works for them. That matters infinitely more than size. Another common question: is it normal to have trouble getting or maintaining an erection? This is called erectile dysfunction, and it's extremely common. It affects about half of men at some point in their lives, and the prevalence increases with age. By age 40, about 40% of men experience some degree of erectile dysfunction. By 70, it's closer to 70%. There are many causes. Sometimes it's physical. Conditions like diabetes, high blood pressure, heart disease, low testosterone, or side effects from medications can all contribute. Sometimes it's psychological. Stress, anxiety, depression, or relationship issues can make it difficult. And often, it's a combination of both. Performance anxiety is a big one, where you're so worried about it happening that the worry itself causes the problem. The important thing to know is that occasional difficulty is completely normal and doesn't necessarily mean something is wrong. But if it's happening frequently, it's worth talking to your doctor. It could be an early sign of an underlying health condition, particularly cardiovascular disease, so it shouldn't be ignored. And there are effective treatments available, from lifestyle changes to medications to therapy. Let's talk about something that affects women: pain during sex. This is called dyspareunia, and it's not normal, even though many women experience it and don't say anything. Pain during sex can have many causes. Sometimes it's about insufficient arousal or lubrication. Sometimes it's a medical condition like endometriosis, pelvic inflammatory disease, or vulvodynia. Sometimes it's related to hormonal changes, like during menopause when decreased estrogen can cause vaginal dryness and thinning of tissues. If you're experiencing pain during sex, please talk to your doctor. Don't just accept it as something you have to deal with. There are solutions, whether that's more foreplay, lubricants, treating an underlying condition, or pelvic floor physical therapy, which many people don't even know exists but can be incredibly helpful. Here's another one that causes a lot of worry. How long should sex last? People often have very unrealistic expectations about this, again largely because of media portrayals. The average time from penetration to ejaculation is about 5 to 6 minutes. Not 30 minutes, not an hour. 5 to 6 minutes. Now that doesn't include foreplay, which is a crucial part of sexual activity, especially for women who typically require more time and stimulation to reach orgasm. But the actual intercourse part is usually pretty brief. Premature ejaculation, which is ejaculating within 1 to 2 minutes regularly and before you want to, does affect some men and can be distressing. There are techniques and treatments that can help with this, including behavioral techniques, topical anesthetics, and medications. If this is something you're struggling with, it's worth discussing with your doctor. On the flip side, some men have difficulty ejaculating at all, which is called delayed ejaculation. This can be caused by medications, particularly some antidepressants, or by psychological factors, or sometimes by physical conditions. This is also something that can be addressed. Let's address a question that many women have. Is it normal that I can't orgasm from penetration alone? Yes, it's completely normal. Most women, estimates suggest around 70 to 80%, do not reliably orgasm from vaginal penetration alone. They need clitoral stimulation. This is anatomy, not dysfunction. The clitoris has thousands of nerve endings and is the primary source of sexual pleasure for most women. Orgasming from penetration alone is actually less common than orgasming with clitoral stimulation. Unfortunately, a lot of people don't know this, and women feel broken or abnormal because of unrealistic portrayals of how sex should work. If you need clitoral stimulation to orgasm, you're in the majority, not the minority. Communication with your partner about what you need is key. Speaking of orgasms, let's talk about the question. Is it normal to have never had an orgasm? This is called anorgasmia, and while it's less common, it does happen. For women especially, there can be many factors involved. Not knowing your own body, not receiving adequate stimulation, psychological factors like stress or past trauma, relationship issues, medical conditions, or medications. If you've never experienced an orgasm and you want to, I usually recommend starting by exploring your own body in private. Understanding what feels good to you makes it much easier to communicate with a partner. There's absolutely nothing wrong or shameful about self-exploration. It's a normal, healthy part of understanding your sexuality. Now let's talk about sexually transmitted infections, because this is a huge source of anxiety and misinformation. First, STIs are extremely common. About 1 in 5 people in the US has an STI at any given time, so if you've contracted one, you're far from alone. Many STIs are easily treatable with antibiotics. Some, like herpes and HIV, are not curable, but are very manageable with modern medicine. The most important things to know about STIs: 1. Many of them have no symptoms, which is why regular testing is important if you're sexually active with new or multiple partners. 2. You can't always tell if someone has an STI by looking at them. 3. Many STIs can be transmitted even with condom use, though condoms do significantly reduce risk. And 4. Getting tested regularly is responsible and nothing to be ashamed of. If you test positive for an STI, it's crucial to inform recent partners so they can get tested and treated if necessary. I know that's an uncomfortable conversation, but it's the right thing to do. Your doctor can provide guidance on how to have that conversation. Let's address something that causes a lot of shame: changes in libido. It's completely normal for sexual desire to fluctuate throughout your life and even throughout the month for women due to hormonal changes. Stress, fatigue, relationship issues, depression, anxiety, medications, hormonal changes, and many health conditions can all affect libido. Low libido is particularly common in women, but it affects men too. If your libido has changed and it's bothering you or affecting your relationship, talk to your doctor. Sometimes there's an underlying cause that can be addressed. Sometimes it's about stress management or relationship counseling. The important thing is not to suffer in silence or feel like there's something fundamentally wrong with you. And sometimes people just have different levels of desire, and that's okay. What matters is finding what works for you and your partner, if you have one, through communication and compromise. Here's a sensitive topic: difficulty with arousal or lubrication. For women, vaginal dryness can make sex uncomfortable or painful. This can happen for many reasons: hormonal changes, particularly around menopause, certain medications like antihistamines or antidepressants, not enough foreplay, stress, or medical conditions. The good news is that lubricants can be incredibly helpful, and they're nothing to be embarrassed about. Many couples use them routinely. There are also medical treatments for more persistent issues, including hormonal treatments. Let's talk about something that doesn't get discussed enough: sexual health after having children. Many women experience changes after childbirth, including pain during sex, decreased libido, vaginal dryness, or changes in sensation. These are common and usually temporary, but they can persist. If you're experiencing these issues, pelvic floor physical therapy can be transformative. It's specialized physical therapy that addresses these exact problems. Also, give yourself grace. Your body has been through something major, and it takes time to heal and adjust. Many people wonder, how often should I be having sex? There is no normal frequency. Some couples have sex multiple times a week, some once a month, some less. What matters is that both partners are satisfied with the frequency and feel connected. If there's a significant mismatch in desire between partners, that's worth addressing through communication and possibly couples counseling. But there's no objective standard you should be measuring yourself against. Let's address a common concern: unusual sensations or experiences during sex. Some women experience a sensation of needing to urinate during sex, particularly with certain positions or G-spot stimulation. This is normal and doesn't necessarily mean you need to stop. Some women experience female ejaculation, or squirting, which is the release of fluid during orgasm. This is normal and nothing to be embarrassed about. Some people experience muscle spasms, or even brief loss of consciousness during intense orgasms. These are generally normal responses, though if you're concerned, it's worth mentioning to your doctor. Here's something that affects many people but isn't discussed openly: changes in sexual function with aging. As we age, sexual response changes. It may take longer to become aroused. Erections may be less firm or take longer to achieve. Lubrication may decrease, and orgasms may feel different. These changes are normal. It doesn't mean your sex life has to end. It means it evolves. Many older adults report having satisfying sex lives. It just looks different than it did at 25. Let's talk about something important: consent and communication. Healthy sexual activity requires enthusiastic consent from all parties. That means everyone involved is actively agreeing and wants to participate. Consent can be withdrawn at any time. If something doesn't feel right or becomes uncomfortable, you have every right to stop. And if your partner expresses discomfort or wants to stop, respecting that immediately is non-negotiable. Communication is also key to satisfying sexual experiences. Telling your partner what feels good, what doesn't, what you'd like to try, and listening when they share the same is crucial. Yes, it can feel awkward at first, but it gets easier with practice, and it makes everything better. One more thing I want to address: mental health and sexual function are deeply connected. Depression, anxiety, and trauma can all significantly affect sexual desire and function. If you're struggling with mental health, addressing that is important for your overall well-being, including your sexual health. And some medications used to treat mental health conditions can affect sexual function as a side effect. If this happens to you, don't just stop taking your medication. Talk to your doctor about alternatives or strategies to manage the side effects. Finally, I want to say that if you're not sexually active by choice, that's completely valid. There's nothing wrong with being asexual or simply not interested in sex. You don't need to have sex to be healthy or normal. What matters is that you're living in a way that feels authentic and fulfilling to you. So here's my main message: sexual health is an important part of overall health. Questions and concerns about sex are normal and common. Your doctor has heard it all before and wants to help you. Don't let embarrassment prevent you from getting the care and information you need. Your well-being matters, and that includes your sexual well-being. Thanks so much for watching today's video. I know this was a sensitive topic, and I really appreciate you being here. If you found this information helpful, please give this video a thumbs up and don't forget to subscribe Take care of yourself, stay healthy, and I'll see you in the next video.